Welcome to the American Medical Association video on Understanding the Relative Value Scale Update Committee, or RUC, survey instrument. If you are watching this video, you were either recently or will likely soon be selected by your professional society to participate in an AMA RUC survey. After watching this, you should have a general understanding of the purpose and mechanics of the survey process, as well as how to correctly and efficiently complete a RUC survey. In order to help you understand the survey process, we'll review the following topics. We will begin with an overview of the survey basics. Next, we will clarify the purpose of the survey instrument and explain each stakeholder's role. And finally, we will break down the survey into a few simple steps. First, survey basics. Why are these RUC surveys being conducted? As you may know, the Medicare Physician Payment Schedule is based on physician work, practice expense, and professional liability insurance. Completing a RUC survey will help your society recommend accurate relative values for work to the Centers for Medicare and Medicaid Services. Each survey is comprised of questions relating to the physician work for one or more services. Practice expense and professional liability insurance recommendations are determined separately from the survey process and are not the subject of this video. Next, the purpose of the survey. The purpose of the survey is essentially twofold. You are asked to estimate the amount of your time that is needed to perform the survey procedure or service, as well as to estimate the intensity and complexity of the physician work involved. The second purpose of the survey is to obtain an estimate of the relative value unit, or RVU, for the given procedure or service. This is done by comparing the service under review to other services that are already valued and have established RVUs. Do not include the time or work provided by support staff, such as RNs, LPNs, medical secretaries, receptionists, and technicians, as their work is measured separately from this survey process. We will now discuss the survey stakeholders briefly. The process itself is overseen by the AMA Specialty Society Relative Value Scale Update Committee, also known as the RUC. The RUC reviews information from societies and recommends work values to the Centers for Medicare and Medicaid Services, commonly known as CMS. Your society, often in collaboration with other medical societies, distributes the surveys to their members in order to obtain the survey data from physicians familiar with the services under review. The collaborating societies then convene an advisory panel to review the survey data and form a consensus recommendation. A summary of the survey data and the medical society recommendation are then submitted to the RUC for review. The RUC review of a medical specialty society recommendation is a formal process and includes presentations by the participating medical societies and extensive deliberation. Once the RUC has agreed on a recommendation, they submit those recommendations to CMS. Then CMS, not the RUC, determines the final value for the CPT code. RUC recommendations are confidential until CMS publishes them in the Medicare Physician Payment Schedule Proposed Rule each July. Relative value units go into effect in January of the following year based on the Medicare Physician Payment Schedule Final Rule. Finally, let's break down the survey into 6 simple steps. To simplify the process, we have broken the survey down into these 6 separate steps. We will review these steps in more detail in the following slides. The first step is to review the code descriptor and the vignette for the code being surveyed. The CPT descriptor for the service being surveyed describes what is included in the code. The vignette is a clinical scenario for the service that is intended to represent the typical patient. The first question that you will be asked is if this vignette is typical. Typical is not your most difficult patient or your easiest, but the one who most often receives the service under review. You may have performed the service on a patient different than the typical one described in the vignette, which is okay. You should complete the survey using the typical patient described in the vignette. If you think that the patient in the vignette does not represent the typical case, you will have an opportunity to indicate this as well. You can still answer the survey if you do not believe the vignette provided describes the typical patient. For the next step, you are asked to provide your contact and basic practice information. This information and your specific survey responses are kept confidential by your professional society. Your de-identified responses are only shared in the aggregate as part of summary of the survey data. Your medical society maintains control of the raw survey data and follows standard survey rules to protect your privacy. You will also be asked a series of financial disclosure questions to assess whether you and/or someone from your immediate family has a direct financial interest in this procedure or service other than providing them in the course of patient care. Please note that simply performing the procedure or service and collecting payment from Medicare or another insurer does not constitute a conflict of interest. Also, if you have any questions while completing the survey, your medical society's contact information will be listed prominently throughout the survey instrument. For the third step, you are asked to review a list of reference CPT codes and then select one code from the list that is most similar in time and work to the survey code descriptor and typical patient described. The services included in this list were selected because their relative values are sufficiently accurate and stable compared with other codes. Your reference choice does not have to be equal in work in your judgment to the survey code, but should be similar. You will use the code you select as a reference when completing the survey. For the fourth step, you are asked to estimate your time. Please note, we ask that you estimate as precisely to the minute as you can. Using the vignette, which represents the typical patient, you are asked to provide an estimate of how much time it takes you to perform the service under review. These estimates should be based on your personal experience and the vignette of the typical patient which was included in the survey instrument. Pay close attention to the service period definitions included in the survey instrument, as they may vary based on the type of the service under review. In general, the pre-service period includes physician work provided before the onset of the service. In other words, before you start the skin-to-skin procedure or face-to-face service the code describes. This may include activities you need to prepare to see the patient, such as reviewing records and any discussions with other professionals. For the intra-service period, there are two general categories. For evaluation and management and other face-to-face services, the intra-service period includes the services provided while you are with the patient or skin-to-skin. For imaging and diagnostic services, the intra-service period begins at the onset of the examination and ends after the examination is interpreted. Please review the definition or definitions provided in the survey in detail. Different groups of physician services have distinct definitions. Activities in the post-service period may include signing off on the report for the medical record and discussions with the patient and referring physician if performed. Next, you will be asked to compare the intensity and complexity of the survey code directly to the reference service code you selected earlier in the survey. The survey asks very specific questions about this comparison on the mental effort, judgment, technical skill, physical skill, and psychological stress involved in performing the service. The rating scale for your intensity responses ranges from much less intense, complex to much more intense, complex. The final and most important step of the survey is for you to provide an estimated work relative value unit, or RVU, for the survey code. When estimating an RVU, you should take into account differences in pre, intra, and post-service time of the survey code and your selected reference service code, your complexity and intensity comparison of the survey code to your selected reference service, the established RVU for the reference code, and how the survey code compares to the other codes included in the reference service list. The purpose of this survey methodology is an attempt to set the work RVU of the survey code relative to the work RVU of your selected reference code, as well as the other codes included in the reference service list, which all have established work RVUs. If you still have questions regarding the RUC survey process, please contact your professional society using the contact information provided in the survey. Thank you for taking the time to watch this video.